patients can self-report their measures of quality at different time frames within their patient journey.
So tell me a little bit more about this pilot, because a big part of Health Yourself Guide was looking at that gray area between hospital and home. What happens when a patient gets home? It might be a lot of time. You're a busy guy in surgery, so I can't, as a patient, call you up and ask you every little question about what's going on with my rotator cuff, for instance. So how are you guys exploring that area?
So we're part of an initiative which measures patient-reported outcomes, and that means that you can put into an anonymous system data about how your shoulder is feeling, what your level of function is, and what your level of pain is at specific time frames after your surgery. And we're using this twofold. One, to educate patients about what the expected course of their recovery is going to be like after surgery based on averages from our own practice in real time. Mm-hmm. And second, in the later phases, such as 6 months, 9 months, 1 year, and onwards, as to whether or not you need to come in for a visit. Because look, for the first 3 months you've been doing really well, you've been following the average, and eventually that program will have a patient-facing dashboard. It's similar to wearing a Fitbit or a Garmin. It gives you instantaneous feedback about your shoulder and can show you how you're doing relative to the expected outcome over time. So I don't know about you, but I wear an Apple Watch, and I like to track my progress over time, and I find that in and of itself is empowering, A, because I have access to the data immediately, and B, because it's real-time data, meaning that I can follow it and track it over time, so I can actually see that I'm going to get better.